Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look into the constipation drugs. So first is, let's look at the stimulant laxatives. Under stimulant laxatives, it includes the senna as well as the bisacondyl, and also the presence of the prune juice. So all these are stimulative laxatives. So action is these agents directly stimulates the peristalsis. So peristalsis is stimulated and may reduce the colonic absorption of water. So reduce colonic absorption of the water. Then we move on to the osmotic laxatives. Osmotic laxatives are nothing but there is lactulose, there is magnesium hydroxide. So there is lactulose, there is magnesium hydroxide as well as magnesium citrate. So all these osmotic laxatives, they are agents, they are not absorbed. So they are not absorbed, and since they are not absorbed, they attract and retain the water in the GI tract. So water is retained in the GI tract. That is lactulose, magnesium hydroxide and the magnesium citrate. Then we move on to the stool softeners. So stool softeners are also known as the emollient or the laxatives. So they include the sodium docusate and also the calcium docusate. So sodium docusate as well as the calcium docusate. So these agents, they act via the detergent. They act as detergents and they decrease the stool surface. So they act as detergents and decrease the stool surface tension, and they increase the water penetration into the stool. Increase water penetration into the stool. Then comes the suppositories. The suppositories as well as the enemas, it includes the bisacondyl and the sodium phosphate enema. So bisacondyl and the sodium phosphate enema. Next we look at the drugs of the opioid induced constipation. So drugs of the opioid induced constipation, it includes the methyl naltrexone, then comes the naldimidine, the naloxegol as well as the alvimopam. Then comes the drugs in the idiopathic constipation. Idiopathic constipation is nothing but the plicanatide is the idiopathic constipation drugs. So constipation is predominant in case of the IBS, and this includes the linaclotide and also the presence of laxatives. The laxatives abuse, it causes the ammonia urate crystal stones. So in case of the laxative abuse, it may lead to the ammonium urate kidney stones. To learn and grow daily like this, please do subscribe.